afternoon, doctor.
Good afternoon,
Please,
ma.
can we know you, sir?
My name is Dr. Gregory Oyinloye. I am the medical director of LEAH Medical Center, and I also work with the foundation, LEAH Foundation.
Oh, it's nice to meet you again, doctor. Um, I want to find out, have you watched the movie Diamonds in the Sky?
Quite a number of times. Quite a number
That
of
is
times.
expected.
Yes.
So what's your opinion? What's your view? What do you think about the movie?
The movie generally is very educative, and it brings to life real life things that happen, things that we see in practice generally. The kind of reactions we see of patients who have been diagnosed of not just cancers, any other kind of ailment, but specifically cancers, the kind of denial, the arc in which they take before some of them actually come to accept that they have it and receive treatment. So it really portrays what happens in real life, and a lot of people can relate with what happened to the characters in the movie.
Okay, talking about characters and reactions to the news, of diagnosis. I want us to, focus on that beautiful young lady called Teniola in that movie. Can you enlighten us more about her character? Then what the diagnosis that was given to her reaction, and
Teniola's character was personally my favorite because because first of all, she was young, she was a student, and a lot of patients we see are really around that kid at that age group, and it ended up well because somehow she had a misdiagnosis somewhere along the way, which is a lot of which is a common thing in this environment. Many a times it's either misdiagnosed one way or the other. It could be a positive or a negative diagnosis. But the problem, or what causes that, is the fact that sometimes a person goes to unqualified people, or sometimes goes to the wrong qualified person to seek treatment to seek diagnosis, and that may delay presentation to a proper medical facility. So what happened to her is something that can happen to anybody. But I think the take home there is that you need to go regularly for screenings at places that are accredited, where you have qualified medical personnel, be it nurses, be it healthcare workers, be it doctors. But you should go to places where screenings can be done regularly and accurately.
Okay, talking about Teniola's, case as well. It ended well.
Yes.
We're happy it ended well. But is that, the common thing? Is it, is it always like that? Or what if it is not? Can you tell us what could lead to, getting a final result that is not so palatable?
Okay, so just as I said earlier on, I think I can point out two things there. The first thing is the fact that she had not been doing regular screenings. If she had been doing regular screenings, she had probably done a scan or something in the past, they would have picked the diagnosis. I don't know if I should mention the diagnosis here because I don't want to give spoilers.
We don't mind. I'm sure my viewers will want to know. Yes,
all right. So the eventual diagnosis was that she had a lesion on the cervix, which was not a cancer, and that she also had endometriosis. Now, endometriosis is a completely different diagnosis. It's not a cervical cancer. It's not an ovarian cancer. It's basically having part of the uterus growing outside the uterus. So during the normal menstrual flow, that also bleeds like the uterus does. And the fact that it's in an enclosure, that's what caused that severe pain which she was having. And obviously, those who looked at her, the initial places where she was given diagnosis, didn't take a proper thorough check at what it could be, or they didn't do the right investigations to know what exactly could be the condition.
And I also noticed there was something that was mentioned in the movie when I think it was Teniola's friends, that eventually pointed her to your center, said something about her sister, that there's a club, something, Please, can you enlighten us further about, she said something about anti-cancer club or something like that in secondary school?
Oh, okay. Basically, some of the things that LEAH Foundation has been known for in the past is creating like communities where people would learn about the signs and symptoms of cancer, specifically breast and cervical cancer, especially in the young women. And of course, when we talk about these things that affect women majorly, the aim of a foundation such as ours is to catch them young, to tell them when they're so they make it a habit to have these screenings done on a regular basis.
Okay.
And with that, we know that these cancers are actually things that we can prevent, specifically cervical cancer. There's so many tiers of preventing the cancer, starting from the vaccination to the regular screenings when the woman has started having sexual intercourse, and also to the treatment as at when early treatment. For example, when you do a cervical screening and a lesion is found that is still not the cancerous, there are treatments that need to be, undertaken such that it does not progress to a full-blown cervical cancer.
Thank you, doctor. Before I let you go,
yes,
I also want you to mention something, to talk on something that was raised. I think in the openings, I think about the second scene of the movie Diamonds in the Sky, there was a part that Teniola and her boyfriend were together, and something was said about abstinence. So could you enlighten us more? Because I'm sure my young viewers will want to know. So what has abstinence got to do with, you catching cervical cancer?
That's a very important aspect of it, because one of the risk factors of cervical cancer, or in fact the major causative organism, is the HPV virus, which is the human papilloma virus, and it's a sexually transmitted disease.
Wow.
In other words, that means the earlier and the more the number of times that there's sexual exposure, the higher the risk of catching that virus, which leads to 99% of the cases of cervical cancer in the developing world.
Please, doctor, I want you to repeat that something about the more.
Yes.
I think that we need to put emphasis on, because LEAH Foundation, part of what I think you've just spoken about is about catching them young.
Yes,
and I think part of the message you are preaching as a foundation is young girls abstaining from early sexual intercourse. So please, could you repeat that phrase?
Okay.
Thank you.
Basically, the earlier a woman starts having sexual intercourse, that means the earlier she's exposed to the virus, and it takes time for the virus to become to cause cervical cancer. So that means the risk of her getting cervical cancer earlier on in life is higher. Then the number of times, the number of exposures, the number of partners is also a risk, because that means at every sexual exposure, she's at risk of catching that virus or being reinfected with that virus, even if she already has a strain. So that also is a risk factor in cervical cancer.
Thank you so very much, doctor. Thank you for your time.
It's been a pleasure,
and I look forward to hosting you on this program again. Over to you, our viewers. You've had the doctors. For us at the LEAH Foundation, being diagnosed with cancer is not a death sentence.